How does the nature of the client's neurosis affect the demeanor of the therapist while in session?
Yes, the client's condition does determine how the therapist approaches them, the therapist's demeanor toward the client. For example, when you're dealing with an obsessive compulsive neurotic or a deprivation neurotic, the therapist, it's important for the therapist to be warm and friendly. It's important, particularly in the case, say, of a fear neurotic or a deprivation neurotic, that they, in order to reduce their fears and inspire a sense of trust, that the therapist be warm, friendly, very tender with the client, like almost a mother or father figure. However, certain clients come in, say a client who's an energy neurotic, a pure energy neurotic. Well, those clients normally are quite hard-hearted, and they're very intellectual. So that what the client is looking for, they're looking for more for intellectual competency. And when those clients come in, they're testing you. They're testing you to see if you are a competent therapist, if you really know psychology or you know philosophy or theology. This is what is important to them. And as you notice in the examples given, where Baars and Terruwe talk about the energy neurotics, very early in the stage of therapy, they talk about Thomistic psychology. They talk about the human psyche according to Aquinas. And what this does is it gives the client an intellectual security or an intellectual trust where they can say, well, he sounds like he knows what he's talking about. I guess he's okay, or I guess he can come back. I guess I can come back to see this guy because he seems to know what he's talking about. Whereas a fear neurotic or pure deprivation neurotic, they're looking for comfort. They're looking for someone to assuage the fears. They're looking for affection. They're looking for approval. Again, that mother and father figure. So in other words, you sort of have to gear yourself to the client. You have to take the client where he's at. Now, in a case of, say, an hysterical neurosis, the therapist must poise himself in a very intellectual, doctoral fashion. The phrase benign curiosity, I think, is appropriate, where the therapist's attitude toward the client is that of being benignly curious. And this might sound very cold, but we have to remember that the role of the therapist in the cases of hysterical neurosis is the therapist is functioning as the intellect for the patient, because the patient is normally deficient in intellect. The therapist is trying to give insights to the client. So in this case, the therapist is not displaying emotions. He's very intellectual, very professional, very doctoral.